Dr. Diez, let's talk about toothbrushing. I mean, we have learned it when we were kids and in school and all the type of stuff, and yet it looks like we all do it different. I think I mentioned to you once, I do my showering, my shaving, my toothbrushing. My wife is still on the first quadrant of brushing, so very obviously we do it different. Now, tell us a little bit about brushing. Should we brush up and down, left and right, in circle? There's so many informations out. Hard brush, soft brush. So should we use electric brush? Give or take. Just give us the lowdown.
All right, real simple terms. If you're going to use a manual toothbrush, it has to be a soft toothbrush. You don't need anything more than a soft toothbrush to properly clean your teeth. The toothbrush bristles should be moving in a circular manner. In other words, like that, okay? And you kind of angle the bristles at a 45-degree angle toward the gum. So the top's kind of angled like that, and you kind of circle and move, circle and move. Same thing on the bottom. You angle it toward the gum, circle and move.
How do you do that in the back? That doesn't look very reasonable in the back. At least I can't do it.
Helmet, I don't know, maybe you have some problems. I'm not really sure, but.
I mean, inside. I mean, when I say the back, I mean inside. A
lot of times what I have the kids do, and I still do it, and that's the way I've learned, is I'll turn the toothbrush longwise. Does that make sense?
Just go up and down, right?
Yeah, you still can do it in a circular manner. You just do it longwise. Okay? Now, I see these toothbrushes in drugstores that you could wash a car with. I've never understood that. The nicer, higher-end toothbrushes usually have a smaller bristle head that's usually pretty easy to fit on the inside. And it's more the inside on the bottom is a little hard to get to. But again, just turn the brush longwise.
Okay.
But that being said, I gotta put my 2 cents in here. I was never a gimmick or a gadget guy, but there are some mechanical or electric toothbrushes out there that are simply fantastic. I had a rep bring one by and just gave me to try. It's like, I probably sat on my countertop in my bathroom for 2 or 3 months, and I figured, let me try it. Since I've tried it, I have never, ever, ever gone back to a regular toothbrush. There are certain toothbrushes out there, and we promote the Sonicare, that is unbelievable. Nothing will clean your teeth as well as that type of toothbrush. So any patient that's really serious about brushing their teeth, and I hope everybody is, or any patient that has a propensity for gum disease, we recommend this type of toothbrush because it will clean your teeth better than a manual toothbrush, even if you're doing it exactly right. And I honestly, truly believe it. I'm living proof.
So does a person, when you have like the Sonicare a toothbrush, does the person have to do less movement?
You really don't hardly have to do any movement. I mean, other than just moving from one area to another. The brush pretty much does it all. I still hold the brush at about a 45-degree angle, but it moves so quick that you really you just move from one tooth or one area to the other. You don't have to sit there and do the motions or anything, which also makes it easier, like you were saying, to get to some of the hard spots. You just get the brush there, and the brush does all the work.
Right, and that must be also easier for slightly older people who already have a problem lifting the arm up to that level and then never mind moving it.
That's right. It's easier for young people who are learning how to brush the right way, and it's easier for elderly people who have a hard time brushing, sometimes with arthritis. To me, it's a win-win-win situation.
Good. Any suggestions in terms of tooth based? Anything better than other, or just what you like? What's the deal there?
2 things that I tell people. I would like for the toothpaste to have fluoride in it. Okay, fluoride is proven helps reduce cavities. And the only other thing I would say is if you have sensitive teeth, there are several toothpastes out there that are made for sensitive teeth, and they do work halfway decent. So those are the only 2 medicaments that the toothpaste should or could have in it. I will say this while we're talking about toothpaste is I typically, especially for my patients with sensitive teeth, will have them avoid any toothpaste with whitening products. For one, they don't work. And two, tartar control. Tartar control, people are stunned every time I tell them this, but tartar control toothpaste will make your teeth more sensitive. So, and nobody seems to know that. The public's not aware of that.
I surely didn't.
Fluoride is really the main thing that I like to see in a toothpaste. But you don't have to have toothpaste, okay, to get your teeth clean. The toothpaste just makes your teeth taste better and your mouth taste better. It's the fluoride that's doing the work, and the toothbrush.
Okay. Well, all right. Here you have it. Now, I lived a couple of years in India, a decade and a half ago, actually, and I saw everybody there using a gum scraper. So I now don't use a gum scraper, but I do use my toothbrush to brush my gum. I mean, not my gum, a tongue scraper, not gum scraper, a tongue scraper. Yeah, and I do brush my tongue and my palate. Now, what's your take on that? Is the tooth should it be used in the first place, or is what I do just as good or not as good, or?
I see more people doing damage with these tongue scrapers. I think they get too aggressive with it. If you are maintaining proper oral hygiene, you're brushing a few times a day, preferably flossing once a day, and you use a toothbrush to clean your tongue and your palate, which that's the helmet. That's the same way I do it. That's all you need. Again, I see people getting too aggressive with the tongue scrapers, and it's just not necessary.
Got it. Now you mentioned something now which I almost forgot, which was the flossing. Do you have any suggestions on flossing since we're on that whole cleaning hygiene thing?
It's flossing. The biggest complaint people say how hard it is to do. All I can say is if you floss and you do it consistently, what's the old rule? You do something for 21 days, it becomes habit. If I can get patients to floss consistently for 3 to 4 weeks, it is very, very, very hard then to not floss, because I hate to say this to all these people that don't floss, but if you become a regular flosser and then for some reason, like let's say you go on vacation for a week and you don't have any floss, your teeth, no matter how much you brush them, will never, ever, ever feel clean. I have a hard time going to bed. I can brush my teeth all I want, but they do not feel properly clean until I floss. So the proper time to floss is after you've done everything, you brush your teeth, you're ready to go to bed, you floss right before you go to bed. And that's the only time you have to do it. You don't have to floss more than once a day. But, flossing is, especially for adults, that's the icing on the cake. That's, when you reach adulthood, if you want to avoid the type of cavities that most adults get, which are in between the teeth, and you want to avoid periodontal disease, gum disease, like we've talked about before, floss. Floss is the number one aid to preventing those diseases, those problems.
Well, all right. Thank you very much.
I will say something else too.
Right.
For patients who complain about floss shredding, there's a lot of floss out there that are like a tape. They're almost like a Teflon tape. They're very easy to use. They won't shred. And some of my patients, they also sell floss that's like on a little stick, and that helps them get back to the area. So there are alternatives to flossing with your fingers or the old type of floss that was very stringy. That, again, make flossing a lot easier.
Thank you very much, Dr. Diez.
Thank you.